our president to address us and make his...
Professor from our neighborhood in Tanzania, we are lucky that you didn't speak Kiswahili because we would have needed a translator. Distinguished guests, ladies and gentlemen, Kenya's commitment to universal health coverage rests on a simple but powerful truth. Every life matters. Today, we reaffirm that commitment by strengthening the partnership that protect our people and protect our region. Kenya and WHO have stood together through outbreaks, pandemics, recoveries, and rebuilding, forging a partnership defined not just by projects, but by shared capabilities in early warning systems, national surge teams, strategic reserves, and digital systems, and rebuilding, forging a partnership defined not just by projects, but by shared capabilities in early warning systems, national surge teams, strategic reserves, and digital systems that turn data into life-saving action. Because of this collaboration, fewer lives are lost, recoveries are faster, and confidence across the continent continues to grow. The advanced life support ambulances will be handed over to all our 7 national referral facilities and the National Emergency Response Center of the Ministry of Health. This support goes to the heart of our universal health coverage agenda, advancing safe pregnancies, healthy mothers, thriving newborns, and responsive systems. The new resources will strengthen emergency referral care, improve oxygen capacity, reduce maternal and newborn deaths in high-burden counties, and sharpen our readiness for cholera, mpox, and other public health threats. Their true value will not be measured not in numbers, but in mothers saved, babies supported, and communities strengthened. Yet maternal and newborn mortalities in Kenya remains unacceptably high. No woman should die while giving birth, and no baby should be lost to preventable causes. The Ministry of Health is under firm and strict instructions to deliver rapid, measurable reductions through real-time reporting of every case, timely clinical audits, and immediate corrective action at facilities and at county levels. I have agreed with the Ministry of Health team that, as I have said, the maternal and child mortality is unacceptably high. We cannot be losing upwards of 300 in 1,000, in 100,000, while the benchmark is 70. I mean, it is completely unacceptable. And going forward, we have agreed with the DHA is going to provide data, and every facility in Kenya, public or private, every facility must provide data on mothers and children who die in their facilities. I know that there are facilities that continue to hide data on mothers who die or children who die in hospitals. We must get the data right, because we must get our act together and reduce the death of mothers and children, especially at birth. I have asked the ministry to conduct an RRI, and the Director General at the ministry has given us an undertaking that by March next year, we will have the correct data on what is our performance as a country, county by county, and then we can therefore be able to respond to this big challenge effectively. I was very embarrassed when I was confronted in New York by a good friend of Kenya who asked me, Mr. President, how is it acceptable in Kenya that upwards of 300 mothers and children die in our facilities? And it is something that has bothered me very much. I know I have discussed this extensively with many of the governors, especially in the counties that have the highest mortalities. And I'm happy that today we are providing facilities for the counties of Tana River, Garissa, Samburu, Marsabit, Siaya, and Elgeyo Marakwet. These are the counties that have some work to do. And we are going to work with the leaders in these counties. The governors and the ministry will provide supportive mechanisms to make sure that we correct what is going on in our facilities. We will intensify the every woman, every newborn, everywhere agenda by equipping frontline teams, securing essential commodities, and ensuring respectful, high-quality care at all levels. Because this is a continental challenge, I also call on the World Health Organization Regional Office for Africa and all partners to work with us to reverse these statistics and strengthen regional health security. Partnership is our greatest advantage, and together we must scale up what works faster. To reinforce this collaboration, I urge WHO Africa Regional Office to expedite the operationalization of the Regional Emergencies and Logistics Hub in Kenya. The Ministry of Health is treating this as a top priority, working to resolve all regulatory and logistical bottlenecks and reporting progress directly to my office until the hub is fully functional. I take this opportunity to congratulate Professor Mohamed Yaqub Janabi on assuming the leadership of WHO Regional Office for Africa, and we look forward, Professor, to a strengthened and results-oriented partnership that delivers measurable gains for our country and for our region. Kenya has given priority to 6 key pillars in the journey to universal health coverage. First, service delivery. We have, working with counties, now have 107,000 community health promoters in partnership with all our counties. They form the front line of primary healthcare, delivering early detection and timely intervention. To support their vital work, the government provides a stipend, and the impact is clear. CHPs have visited 8.9 million households, screened 9.9 million Kenyans, and made more than 439,000 referrals. County governments also deserve recognition for strengthening primary health facilities, supported by the new Primary Health Fund that pays for outpatient services. Second, a motivated health workforce is essential. We have resolved long-standing issues affecting healthcare workers, including settling the Kenya shillings 3.5 billion in arrears owed to doctors and improving terms for other cadres. Third, we are rolling out an integrated health management information system. Already, 1,378 facilities in 19 counties are online, with thousands more at various stages. As our digital superhighway is completed, Kenya will achieve data mobility, expand telemedicine, and improve efficiency across systems. Fourth, Social Health Authority is now the engine of universal health coverage. More than 27 million Kenyans have registered with daily enrollment exceeding 30,000. SHA brings together the Primary Health Care Fund Emergency Chronic and Critical Illness Fund, and the Contributory Social Health Insurance Fund, including what we have brought together under the health ecosystem, including one piece of legislation that we are still waiting for passage in Parliament. In the current financial year, we have allocated 13 billion shillings to the Primary Health Fund and 8 billion shillings to the Emergency Chronic and Critical Illness Funds, supplemented by county revenues and other sources. Number 5, we are strengthening access to safe and affordable medical products. The Kenya Medical Supply Authority has been repositioned as the National Procurement, Warehousing and Distribution Agency. We have allocated 1.5 billion shillings to capitalize KEMSA and established a Kenya shillings 10 billion line of credit, targeting a 90% order fill rate and reliable availability of essential medicines and commodities nationwide by the end of this year. I have said this before, the biggest challenge we've always had in our facilities, the biggest complaint from citizens is hakuna dawa. And we need to treat this hakuna dawa thing. And we have agreed, and I want to commend county governments that we have agreed that now commodities, when they leave the warehouses from KEMSA, they do not go to county stores. They go straight to facilities, either health centers or dispensaries or level 4 facilities, so that we cut down on time between when commodities are ordered and when they are delivered. We have also agreed that every facility will have an F5 or Facility Improvement Fund that will also respond to situations and requirements in every facility in good time. We have also agreed that to be able to make sure that there is regular replenishment and there are no issues of debts being accrued, there is a mechanism for how payments for medicines will be netted off with the SHA payments. Again, this will support our delivery of health. Number 6, because of governance and leadership which anchors these reforms, we remain fully committed to delivering universal health coverage supported by a strong team at the Ministry of Health and dedicated governors across 47 counties. To solidify reforms, we enacted 4 transformative pieces of legislation, and I am very proud that this is giving us a very sound footing on how to deliver universal health. I am confident that they will continue in that spirit as the Quality of Care and Patient Safety Bill is now under consideration in Parliament. Universal health coverage is now a reality for most Kenyans than ever. Primary health services in all SHA-accredited facilities, including public, private, and faith-based, are funded by the Government of Kenya. With strong partnerships, especially with WHO, Kenya is firmly on the path to achieving universal health coverage. Professor Janabi, once again, and your team at WHO, I thank you for your partnership and steadfast commitment to health of not just Kenya, but also our region. Thank you very much for your attention, and I look forward to working with all of you. Shortly, we will be having a conversation on the progress that has been made and feedback on what we can do better. And I am looking forward to that conversation with health providers, all the stakeholders, citizens, and partners like WHO and others. And to thank all the people of Kenya who have come through, every citizen who has taken time to register and to participate so that we can eventually deliver on this most critical element of health to all our people. Because Section 43 of the Constitution of Kenya mandates government, both at the national and the county, to deliver the highest quality of health to all citizens. It is not a privilege for those who can afford or who have jobs or who have means. It is a right for every citizen of the Republic of Kenya, irrespective of their social, economic, cultural, or any other consideration. Thank you very much. Asante sana.